of our fearsome fivesome here is Karen White. She's the Director, Office of Statistical and Economic Analysis, Bureau of Transportation Statistics, U.S. Department of Transportation.
All right, good morning. So just, following up on Marcy, so BTS is one of the 13 principal statistical agencies. This does give us some abilities and responsibilities that enabled us to move in different ways so that we are able through legislation to keep privacy, any material that we are collecting, and I'll talk a little bit about how we make sure we use that ability to, I swear I didn't do it. And it's also interesting that since I am with the Office of Statistical and Economic Analysis, I always say I'm our #1 data user. But it's been great to be here with so many people in here again and again and again. The need for data, the need for being able to compare across jurisdictions and be able to visualize what's happening in broader spectrums. Just as a sidebar, I always think that our goal at BTS is to create that net, if you will, that covers the entire country, and then working with local data providers, you want to drill down, you want to get more information than quite frankly the federal government can collect affordably and that the American people basically have charged us to get. And that's a great way to come up with these roles. And what we're hoping is that through the abilities of groups like this, we can come up with ways to knit that information together across the net so that you can use our transportation networks, our transportation data, and our accessibility measures to be able to then complete and drill down into the more complete picture, looking at health and accessibility. So I'm going to talk a little bit about 3 different areas of focus related to health and accessibility, safety, clean air, and then focus a bit on connectivity and active transportation. One of the areas where we use our, it's called SIPSI, our rules for confidentiality, and it's interesting to the transit community because we have built a system to allow users, through memorandums of understanding with our example agency here is WMATA, and also with their unions. This allows people who see a close call incident in the transit environment to call in anonymously and give all their information. That information is then protected from FOIA. It is protected from basically people trying to find out, so who was the guy who called in and said something unsafe happened? A close call is something that doesn't rise to an OSHA incident. It does not rise to the level where there actually was an injury, but it takes somebody who's a worker in the system who says, that's dangerous. We shouldn't be doing that. Or we should have better signs or a light that goes off when someone is entering the transit facility to have maintenance. And so this talks a little bit about what we've done with WMATA. We're well aware that, everyone will say there's a lot to go in WMATA, but we have this system where people call in, they enter first through a web, and then they have interviews, one-on-one interviews. Through that, we've developed over 55 preventive safety actions, things like concave and convex mirrors to help operators see around the corners, better signage, complete signage, some things that, it gave the workers a way to improve their system so it could be safer. Now jumping over to perhaps an area that you guys have seen in our data, which is the National Transportation Atlas data. This is our mapping data. And you'll see there what is going to be a collector's edition is the 2015 DVD. The last year there will be a DVD. It is now all on a downloadable portal, and if anybody wants it, I didn't want to put up the whole URL up there, but you can see me later or send me a thing, and I'll get you that. This gives you transportation networks, flows of people, goods, vehicles. What we don't measure so much is the why. Why are those trucks moving? Why are those cars moving? Why did that airplane go from A to B? And what did the people want to do who were in there? Uh-oh. Okay. And now, there we go. That's just a picture. This is alternative fuel stations. This is selected airports. One of the areas I've noticed people haven't been talking about here is what loosely goes under the name of medical tourism. This, in our increasingly connected environment, is becoming a standard operating procedure. We had very close friends who when they learned their son had cancer, they said, well, you'll be needing to go to Pittsburgh twice a week, every week, for the next 6 months. Hope that works out for you. And so, you know, there was a lot of transportation, not just in the local environments. This is Amtrak stations. Here's the highway system. All of a sudden we get very complete. So this is going to there are lots of data fields in there, and we're constantly increasing it larger, but this is just to give a little bit. We have the infrastructure locations, border crossings, passenger facilities, the non-attainment areas. This is all in GIS format, so the idea is you can then also add in others, and we're also working to bring in a larger set. Okay. And wanted to bring up another database we have of interest to this group, the Intermodal Passenger Connectivity Database. This allows passengers it will show you the fixed rail transit relative to where the airport is, relative to where the fixed bus schedules. We're getting intra-city bus. We're working with FTA and the National Transit Database to have bus service. Right now, we're working on the 10 largest metropolitan areas, and I think we have 4 of them complete at this point. But we're hoping to fill that out and actually have the top 25 a year from now. And we also have the National Household Travel Survey, and I'd love to talk with Marcy later about what we can do to link up the National Household Travel Survey, because we do talk about medical conditions in the National Household Travel Survey. We pay people, but well, not much. We found small inducements do get people to respond to it's a 2-stage survey. The first is just a higher level survey. You get $2 if you get one of those. And then if you take the larger survey, I think the current fee now is $16. We found odd numbers. People do more with odd numbers. But we'll get trip purpose, medical, dental, and we'll find out if a medical condition limits your transportation, the length of time that you've had your medical condition, and we also use this data to come up with walkable and bikeable trips. And because access to health isn't always a negative health event, it's also the access to positive health. This was just a quick picture of some of the data looking at transportation disabled by age. And then also we have airline data, again, talking about that broader health community, not just the smaller areas. Now back to the household travel survey, we do have information on purpose of the trip, and I did this off the high level data, but then the micro data, that group called Other also breaks down into medical. So you can find out how many people are taking trips. This is just a little summary picture of some of the areas we have. I'll give a plug for our passenger travel facts and figures, which is a quick and easy way to point and grab and click and get a quick snapshot of passenger data across many modes. It's also, I should have brought some 2015s because they're also going to be the last time that it's going to be a paper. From this point forward, they're all going to be electronic, and everything, of course, is available at our website. Thank you.